Today our topic to continue our respiratory system, and our topic to continue the organs which also take part in respiratory system is trachea. Okay, if you talk about trachea, we need to know halototopy of trachea. Halototopy of trachea we have from neck region, neck and chest region. The halototopy of the trachea. Okay, and if you will talk about the skeletotopy of trachea, then skeletotopy of trachea we have from C6 to C7. We have superior level, okay, and here from C6 to C7, this is superior. We are from the start from the larynx, okay, and inferior level we have T4 to T5 thoracic vertebra. This is the skeletotopy and halototopy of the trachea. Okay, now if you talk about the length and diameter of the trachea, okay, because also in the structures of trachea, if you talk something about the structure, its length 10 to 15 centimeter, okay, in normal person 10 to 15 centimeter is length, okay. If you talk about the diameter is 2 to 2.5 centimeter is diameter. This is the diameter, okay, and this is the length 10 to 15 centimeter, okay. This is the length of the trachea and diameter of the trachea, okay. Actually, because if you talk about the structure more, anterior view we have horseshoe shaped trachea. It's why, like here, horseshoe shaped, this is a horseshoe shape, okay, because the anterior view the horseshoe shaped area is cartilaginous, okay, cartilaginous or cartilage of trachea, okay, and from the back here we have membranous part, okay, membranous part. I mean, this is the anterior view, it's the cartilaginous part, and from the back we have muscle, and here we have from the back we have membranous part of the trachea, okay, membranous. If you talk about anterior view, okay, the front side of trachea, we have cervical fascia. This is the general information. Cervical fascia, we have there pretracheal fascia. There we also have muscles like sternohyoid muscle, we have sternothyroid muscle, okay. This is from the front side. From the lateral sides, we have narrow vascular bundles, and narrow vascular bundle, where we have common carotid artery, we have vagus nerve and internal jugular vein, okay. This is from the lateral side and from front side, and from the back side we know, from the back side of trachea we have esophagus, okay. It means from the back side we have esophagus, okay, of trachea. These are the we discuss little information about the structure of the trachea, okay. Now if you talk about more about the trachea, about the structure of trachea, okay, here this is the cartilage of trachea, okay, cartilage of trachea, tracheal cartilage, which maintain the structures from the cartilaginous structure of the trachea, cartilage, okay, and these cartilage are connected by ligaments. Its name annular ligament, okay. These trachea are connected each other by annular ligaments, okay, connected each other and maintain the structure of the trachea by ligaments. Its name, it's annular ligaments, okay. And from the back side, I told this membranous part, there we have no ligaments because this is the horseshoe shape. I already told the structure of the trachea. Okay. Now, if you talk about the layer of the trachea, layers, here we have tunica mucosa, we have tela submucosa and adventitia. Now, tunica submucosa, there we have respiratory epithelium. Okay, respiratory epithelium. And what is the main function of the, again I will tell you some about the function of trachea. Trachea passes the air to and from the lungs. Okay, and the epithelium of the trachea, tunica mucosa, they are covered by respiratory epithelium. Okay, lined by respiratory epithelium. And there we have cilia. If some foreign object or foreign body coming from the outside, then you feel like cough. Okay, respiratory epithelium. Okay, and Trachea submucosa, you know, we have vascular, there we have vessels. Okay, vessels and adventitia. Okay, this is the also layer of the trachea. This is some little bit information about the layers. Okay, and then trachea, where the trachea divided into two others, main bronchus, the bronchus area where the division of the trachea, this area is called bifurcation of trachea, bifurcation of trachea, or carina of trachea. Okay, these are the area where division of the bronchus. Okay, now we will continue about the bronchus. Okay, because the second from here, from the trachea, we start is the bronchi. Okay, because bronchi is also the organs, okay, of the respiratory system. Now we are going to continue our bronchi. Okay, bronchi. Okay, here where the area I already told the division of the trachea, where the division of the trachea, this area is called carina of trachea, and divided into two bronchus. Okay, right main bronchus, and left main bronchus. Okay, now if you talk about the right main bronchus is 2.25 centimeter long and wider and shorter. Okay, the right one. Okay, right one bronchus. If you talk the left main bronchus, okay, the left main bronchus is little bit long in length. Okay, it's 5 centimeter long, but here is narrow and longer in length. Okay, because is here the right one is main bronchus, the right main right primary bronchus, or left primary bronchus, or left main bronchus. The right one is wider but is in length is short. Okay, here is long but wide, narrow. Okay, the left one. Now the bronchus, the right and left main bronchus, if you note the right and left lungs, right lung we have 3 lobes. Okay, here if you talk about this is lungs. Okay, lungs, right lungs we have 3 lobes, and here we have 2 lobes. If you will continue our bronchus, means this is the bronchus, the 2 bronchus, the main bronchus coming from trachea. Okay, these 2 bronchus divide into bronchus. Okay, other bronchi. The right one divided into 3 lower bronchus, and the left one divided into 2 lower bronchus. Means here 3 means superior, lower bronchus, middle lower bronchus, and inferior lower bronchus. This is the right one. Left one we have superior lobar bronchus and inferior lobar bronchus. Okay, this is the left lung. Okay, this is the about the bronchus. Okay, if you talk where the bronchus, where the bronchus, the left and right main bronchus were enter into the lungs, this area is called helium. Here is the helium of lung. Okay, here is the helium of lung where they are enter into the lung. Okay, about the lungs we have different topic, but here for your memorization and for your concept I will clear, because when the bronchus divide into the other bronchus, superior, middle and inferior bronchus, these are the in the left right lungs we have 3 bronchus, and the left we have 2 bronchus. Okay, and according to surgery in lungs we have 8 in the right one we have 10 segments, and left one we have 9 8 or 9 segment. Okay, it means right we have 10 segment according to the surgery 10 segment, and left we have 9 or 8 segment. Okay, this is very important in surgery. Okay, this segment you need to remember in the lungs. Okay, because this segment will help into when we will like discuss, going to continue our discussion about the bronchial tree and alveolar tree. This segment will help us. That's why I told you this topic is not about the lungs. Okay, this we are just discussing bronchi. Okay, now you understand the bronchus division. Now we discuss the bronchial tree. Okay, now here I already told. Now here this is the main bronchus. This is the bronchus. Okay, this is a trachea. They are divided into into the other bronchus, means superior, middle and inferior. Okay, it's the right one, this is the left one. Okay, now they are continued division. When they are entered into the lungs, they are division into the segmental bronchioles, here also. Okay, others they are continuous into the terminal bronchioles. They also have further division inside the lungs. It's called terminal bronchioles. This is a bronchial tree. Okay, bronchial tree. And about the bronchial tree means this is the right and left main bronchus. Right and main bronchus division into superior, middle and inferior, the right one, and the left one is right superior and inferior. Then they are further divided into the segmental bronchioles, and segmental bronchioles are further divided into the terminal bronchioles. And these bronchioles are, now I will tell you in the, if you will talk about the bronchial tree from inside are in inner side lining by respiratory epithelium. Because respiratory epithelium, there we have cilia, and cilia, when some, like for example, if this is very important function here from the foreign aspiration, if something like enter foreign object, foreign body enter from like in airway enter, and we inhale and going to the lungs. Okay, then there's very special medical help procedure using. Okay, for these things. This very is like in practically I don't have someone to show you this this position. Okay, but this, remember, like where the segmental bronchioles. Okay, there the from inner side the bronchus are lining by respiratory epithelium. Okay, and respiratory epithelium we have cilia. Okay, cilia. Then we, at the end, when they reach into the terminal bronchi, there they are lining by cuboidal epithelium. This is about the layers, very important in layers of a bronchi. Okay, now if you will talk about the, when the terminal bronchi, they are divided into from the here the starting at the alveolar tree. Okay, alveolar tree. We discussed bronchial tree before, but from here started alveolar tree. Okay, if you talk the alveolar tree, for example, we have bronchial. From here we can start bronchial. Bronchial means terminal bronchi. Okay, bronchial terminal. Okay, for example, this is a terminal bronchi. Okay, terminal bronchi, they are further divided into the, here is the primary bronchi, and there have secondary, and then we have tertiary bronchi. Okay, and this is also called respiratory bronchioles. Okay, this is the terminal bronchi. Terminal bronchi divide into primary, secondary, and tertiary bronchioles. Why I write this is alveolar tree, and here we have alveoli. Okay, here we have alveoli, and this alveoli continues into the alveolar ducts. Okay, ducts, and alveolar ducts ends here into the alveolar sacs. And here we have alveolar sacs. Okay, this is the little bit concept about the bronchial tree and alveolar tree. Okay, from here you can understand. Okay, here I tell we have the division of the trachea into two bronchus, right main bronchus and left main bronchus. Okay, right main bronchus is short but wider, left is long but narrow. Okay, and these bronchus were entered into the lungs. This area is called helium. When they are entered into the lungs, okay, the right lungs, we know we have three loops: superior, middle, and inferior loop. We'll going to in the next topic in lungs. Okay, we'll go into the structure about the lungs, and there we will discuss the loops. But for little information here also you need to know. Okay, and the left also we have two loops. When they are entered into the lungs, they are divided into the other three. In the right one is three lobar bronchus, and the left one is two lobar bronchus. Here we have superior, this is superior, then middle and inferior lobar bronchus, and here also we have right and superior and inferior lobar bronchus. Okay, and in the bronchial trees, these lobar bronchus continue into the segmental bronchi, because in the right lungs we have 10 segments, bronchial segment, and the left we have 8 to 9 bronchial segment. Okay, then this bronchial segment, okay, continue into the segmental bronchiole and terminal bronchi, where we have imparted to know about the covering from inside. From here the covering inside from the respiratory epithelium, and because respiratory epithelium we have cilia, and then at the end terminal bronchioles they are lining by cuboidal epitheliums. When we will discuss the alveolar tree, then we will take the terminal branch, and terminal branch continue to the primary, secondary, and tertiary bronchioles, or you can say respiratory bronchioles, because here we have alveoli and alveoli ducts. Alveoli continue into alveoli ducts, and then we have alveolar sacs. This is the alveolar tree. Okay, and from the inside here, if you will talk about from here the terminal branch, I told we have cuboidal epithelium. When they are reached into the alveoli, where the alveoli, there we have lining from inside, lining by simple squamous epithelium. Okay, this is about the layers of the epithelium. Okay, because if you will talk about the bronchi, there we have also tunica mucosa. Okay, muscularis, smooth muscle layers. We have talus of mucosa and adventitia. Okay, in bronchi, if you talk about the layers of bronchus, bronchi or bronchi, okay, we have tunica mucosa. Like from the inside, if you will see here, bronchioles, we have tunica mucosa. Then we have talus submucosa, where we have vessels, submucosa. Then we have smooth muscle layer, and the fourth one we have adventitia. This is adventitia. Okay, these are the layer and astrological information. Okay, we already discussed, I already told where we have respiratory epithelium, where we have cuboidal epithelium, and where we have at the end where we have alveolar tree, where we have simple squamous epithelium. This is short information about the trachea and bronchioles. Thank you for watching.